You're listening to Puma Podcast.
There's one person from Quezon na nagbigay na ng service for 40 years. Talagang she's been there for a really long time and she's been trained yearly. And kumbaga, kilalang-kilala na siya ng mga kabarangay niya because with or without uniform, alam na siya yung tinatakbuhan eh. Kasi usually takbuhan talaga sila sa barangay if anything happens na emergency. Tinanggal siya, pagdating niya sa clinic, bigla na lang sinabi na, hindi ka na daw BHW. Dinibdib niya. Obviously, because one, walang nagsabi sa kanya. When she got to the clinic, doon lang niya nalaman na tanggal na pala siya. Nobody talked to her, but obviously, she knows why it happened.
Hi, I'm Franco Luna, Puma Podcast, and you're listening to Teka Teka News. In this episode, we zoom in on the impact of the October 2023 barangay elections on the health of barangay residents.
So a lot of the barangay health workers I've talked to, madalas ang nangyayari, pagpunta nila sa clinic to do their duties, biglang hindi na sila papapasukin na, hindi ka na daw BHW according to kapitan, ganyan. So nagugulat sila without them even knowing na, wala na pala akong gagawin. Parang nakaka-hurt din.
You just heard Barangay Health and Wellness Party List Representative Angelica Natasha Ko. Over the past month, her office has received reports that over 80,000 barangay health workers, or BHWs, have been let go since the recently concluded barangay elections, seemingly without due process.
As a total number lang, we really cannot pinpoint how many they are because year in, year out, may natatanggal, may nadadagdag. So it keeps on changing. In fact, the data from DOH is different from DILG. And our office has been collecting data also, just so we can see talaga kung ilan, and at least we know kung counted siya this year or not.
The party list representative says the common denominator in all of the cases is that the sacked health workers didn't vote for the eventual winners. Some of them didn't even vote at all and were punished for it. So newly elected officials are replacing experienced BHWs with their own allies, disregarding the crucial role these workers play in primary healthcare delivery. Some barangay captains even appointed their own family members. So political talaga ang nangyayari.
Parang hindi naman sila binigyan ng dignidad. Kumbaga, sabi nga nila, sana kinausap man lang ako, what's wrong? Sana alam ko kung bakit ako tinanggal. Hindi yung parang pagdating ko doon, bawal na ako mag-volunteer. Parang ganun talaga siya. So it's very sudden na nalalaman lang nila through hearsay because sometimes even the captain won't even face them na to say na wala na, no? And na napalitan na sila.
So why does this matter? Imagine an entire community suddenly left without their trusted health resource. The consequences are alarming, even more so for the pregnant, the disabled, and the elderly. Unang-una, barangay health workers are volunteers or minimally paid workers who are at the front lines of healthcare in the Philippines' 71,000 barangays. They provide prenatal care, immunization, first aid, and other basic healthcare services. They also conduct health education and promotion campaigns and monitor community health trends and report outbreaks. Here's Congresswoman Ko narrating a typical day of a barangay health worker.
What do? From the clinic, they get their records, they go house to house. Sina-check nila lahat ng babies, lahat ng mga anak. They do the checkups, parang mga routine checkups and routine yung parang vaccine rollout. So, kunyari, this is the season for tigdas. Pupunta sila, mag-roll out sila ng programa. From the clinic, they go to these different households, tapos sila yung mag-execute ng programa.
BHWs are often the first point of contact for people in their communities who have health concerns, and they play a vital role in referring patients to higher-level healthcare facilities. They are also trusted figures within their communities, since they're deeply rooted in their areas, speak local languages, and understand local needs. BHWs bridge the gap between communities and the healthcare system, advocating for their community's health needs and ensuring that everyone has access to quality healthcare. And despite the vital role they play in their communities, many BHWs are volunteers or receive only a small stipend, which can make it difficult for them to support themselves and their families. They also often receive minimal training, and they may not have access to the resources they need to do their jobs effectively. The challenges of the job can lead to burnout, which can further exacerbate the shortage of BHWs. So what happened to the BHW Angelica was talking about at the beginning of this podcast?
So pagdating niya sa bahay, dinibdib niya ng grabe. Para tumaas ang BP, na stress, ganyan. Ayun, namatay.
Here's one question I asked. Are barangay health workers paid well? Do they get benefits? What do BHWs get from their job?
Obviously, itong mga barangay health workers, kaya naman sila nagvo-volunteers, it's not because of the money. What they're getting na allowance, pinakamababa I know is 50 pesos, pinakamalaki I know, or well, the average is 1,000. So, a month yan ah. So, parang hindi naman talaga siya about the money, because if it's about the money, then, alam mo yun, mas malaki sanang nakukuha nila. But, dinibdib niya to because parang buhay niya na kasi ito eh. Many of them who started as barangay health workers didn't even get anything. Dahil nga volunteer sila even way back. So parang for them, it's their dignity na inapakan.
We're pausing for a quick break now. When we return, we'll tell you about why barangay health workers historically fall victim to politics at the level of barangays.
Now, because we're really lacking of barangay health workers, ang nangyayari, one BHW is to maybe 300 households. It goes up to even 500. Some I know 700 households. So talagang 700 households, sometimes 2 families. It depends na. But yeah, ganun po kadami ang households na hinahawakan ng isang barangay health workers.
Again, that was Barangay Health and Wellness Party List Representative Angelica Natasha Ko. As with job turnovers, newly appointed BHWs will have to undergo training, and the barangay will have to shoulder those expenses. Think about how much it costs to train the 80,000 BHWs who were never reappointed by their new barangay captains. And think about the untrained ones that are coming in now to fill their shoes. This lack of skills and experience only affects the well-being of barangay residents and their families. It also strains local healthcare resources as untrained replacements enter the system.
Yung mga tinanggal na mga BHWs, they've been there 30, 40 years. They've been giving out service, 30, 40 years of their lives na para bang yung expertise nila on the matter. Kasi, I mean, for sure, memorize nila per household kung sino may sakit dyan at sino yung walang bakuna dyan. So, syempre, kung magpapasok ka ng panibago, it's another how many years of training na kinakailangan para maging kasing galing niya yung tinanggal na BHW. For you to be a BHW, let me clarify also that they need training first. You can't be a barangay health worker, registered and accredited BHW, if you don't train for 3 years. That's under the law naman. Kung bago ka, hindi ka pa talaga BHW.
Many dismissed BHWs have years of extensive training and experience. So when you lose them, you lose invaluable knowledge and medical history of the community. The absence of dedicated BHWs has resulted in critical delays and inadequate responses to medical emergencies. That significantly impacts the overall health of the community. So yes, BHWs do play an essential role in the Philippines healthcare system. They're the backbone of primary healthcare in rural and underserved communities. And they help to ensure that everyone has access to basic healthcare services. Meanwhile, barangay elections are held every 3 years, creating a cycle of vulnerability for BHWs. Even outside of the electoral cycle, BHWs often receive meager stipends and lack full-time contracts, further increasing their vulnerability. The BHWs Benefits and Incentives Act provides some legal protections, but implementation and enforcement can be weak in the face of politics and cronyism down at the barangay level.
Yeah, well, some sinasabihan talaga na, kasi kalaban, bumoto ka sa kalaban, parang gano'n. Oo, garapalan na parang gano'n. Or for example, the other day, kasi pamangkin ka nung kalaban ko, eh. Like, the captain is not even sure kung sino talaga binoto, but assuming because pamangkin siya nung nanalo nung kalaban, tanggal na siya agad.
Perhaps this is also a reminder that even at the level of barangays, it's important to choose leaders who value experience, qualifications, and community well-being over political opportunism. And to aspiring officials, remember, our barangay health workers are pillars of our communities and not political bargaining chips. So invest in them, empower them, and let them serve with dignity and respect. Here's Congresswoman Angelica Natasha Co again to remind us that our volunteer community doctors and nurses are people too. And while many of them were reinstated after news of their replacement broke, others are still jobless to this day.
Marami sa kanila medyo aging na rin, so marami na rin nagkakasakit na. They're starting to get all these diseases. So hopefully matugunan na ulit yung mga basic medicines na kailangan pang maintenance, etc. They're still part of the population who needs medical attention. A lot of these barangay health workers do not have their own medical, I can say, freedom, I guess, no? Parang nasa health sector sila, pero sila mismo hindi libre sa pagpapagamot, hindi sila libre sa pagpapa-hospital, or even the medicine.
And that was today's episode of Teka Teka News. Again, I'm Franco Luna. This episode was edited by Pidoy Blanco. Our Teka Teka News executive producer is Jill Cado, and our senior editor is Veronica Uy. If you found this episode useful, share it with a friend. Help Teka Teka News reach more people and keep the show going. Thanks for listening.